Let's start off with South Australia, though, and this massive overreaction to that latest cluster. We had all those restrictions brought in yesterday. There were only 2 additional cases confirmed overnight, so they have a cluster at the moment of 22. Now, they fear it is spread more widely. They have about 4,000 people in isolation and lots more being tested. But on the basis of this, 22 people, they have now imposed a drastic lockdown on all of South Australia. I should add that of those 22, so far from the reports, nobody is sick. A couple of elderly people who have been infected have been put into hospital as a precaution, but there are no reports of anyone being particularly sick from this cluster, and yet the whole state has gone into a sudden and dramatic lockdown for 6 days, starting tonight at midnight. It was announced at a dramatic press conference today, which heard from the Premier, the Police Commissioner and the Chief Health Officer. Have a look.
We are really asking the people of South Australia to join with us on this mighty quest to stop this disease in its tracks. We want to stamp it out before it takes hold in South Australia and ruins our economy.
Things that are being closed or shut down effective midnight tonight are all schools except for children of essential workers and vulnerable children. Takeaway food will be shut. Universities will be closed. Pubs, cafes, coffee shops and food courts will be closed. Elective surgery, except for urgent operations and cancer treatment, will be closed.
This is the entire state. We don't have a ring road or a circle of steel that we can put in place. And the other thing is, I don't know if somebody who went and got a pizza at the Woodville Pizza Bar then went and travelled, somewhere into our regional centres. So this is applying to everybody in South Australia, and we're all going to do this together.
Now, this is just extraordinary. This is businesses shut down, people can't go to school, people limited to their own area, as you just heard, then people are not allowed to travel around the state, and people living 500, 600, 800 kilometres from Adelaide, where they're hundreds of kilometres from where there's been no infections for months, they are being forced to lock down as well. It is quite extraordinary. Of course, we all know too that the one way to make certain that people panic is to tell them not to panic. And at that press conference, people were told not to get into panic buying and the like. So immediately, right around South Australia, this is what's happened. I've spoken to a lot of people from South Australia this afternoon, and the first thing that happened was they all went to the shops because they all wanted to stock up. They all then want to go to either their holiday house or their family home, get to somewhere where they can bunker down for 6 days. They don't know that it's going to be 6 days. They all hope so, but everybody knows these things have a habit of being extended. It seems to be an absolutely drastic and over-the-top response from yet another state government from a cluster of 22 infections in a state of almost 2 million people. It is quite extraordinary to see this unfold. What it does expose, though, is how in South Australia, Queensland and Western Australia, and Tasmania for that matter as well, they are not really buying into the national strategy of living with the virus, suppressing the virus and being able to deal with clusters and infections and as we go about our lives. They are effectively trying to eliminate the virus. They see any infection in their state as a blow, a slight against the personal standing of the premiers and against the whole edifice of government. And that was given away today in a press conference in Western Australia by that state's Premier, Mark McGowan.
My view is the best thing to do is keep the virus out. Keep the virus out. The model by which you have outbreaks and then contact trace and crack down on it is not the best model. That seems to be the New South Wales model. It is not the best model.
So that's it. The way that New South Wales is keeping the economy open, keeping schools open and having social distancing and contact tracing and dealing with breakouts of this virus. Apparently that's the wrong way, says Mark McGowan. And clearly Stephen Marshall in South Australia, Anastasia Palaszczuk, Peter Goodwin in Tasmania, they agree with this. They're trying to eliminate the virus and it crushes businesses, it crushes communities, it creates hardship and heartache for people. They don't seem to care. It's all about eliminating this virus. We'll catch up with some people who have been directly affected in South Australia in just a moment. But there's another point here. There's another very, very salient point about Stephen Marshall and the way he's responded to this virus in South Australia. Firstly, it's the overreaction. I'm most critical about this overreaction, as I was with Daniel Andrews in Victoria, because the virus will get out. The virus is connected to people and we will have infections. So while they need to be very strict with their hotel quarantine and the like, I don't get too head up that there are failures now and then, because there will be failures. It's a highly infectious virus. But you've got to have proper processes. You've got to do the best you can to minimise that risk of infection. And that's where Daniel Andrews has been widely criticised, and rightly so, for the hotel quarantine problems in Victoria. And Stephen Marshall has failed to learn the lessons. We talked yesterday about how the staff in the hotel quarantine facilities in South Australia have not been tested for the virus. There was no regular testing of the cleaners and security guards who were filtering in and out of hotel quarantine in South Australia. Already, the federal government has stepped in there and demanded that across the whole country, where people are working in hotel quarantine, they need regular testing. So that's one failure. We learned of another today, though, that is quite extraordinary. Again, a clear lesson from Victoria was you can't have people working in hotel quarantine and then going off to other jobs, because it creates an opportunity for them to spread the virus. A private security guard in the South Australian hotel quarantine had a second job as a, yes, you've probably heard, a pizza delivery driver, working in a high-risk hotel quarantine environment by night and then going off to deliver pizzas. You could not ask for a higher risk combination of jobs there. Getting someone to work in a high risk place for virus infections and then get them into a delivery job. How they didn't cut off those sort of opportunities right from the start after seeing what happened in Victoria is just beyond me. And in South Australia right now, nearly 2 million people are paying the price for that sort of inept management and also this overreaction when it comes to the shutdown.